So we have started joint, flexion, extension, abduction, adduction, rotation, then circumduction, forearm pronation and forearm supination. Okay, and foot eversion, foot inversion, फिर protraction, then retraction. Okay. Now the terms used for describing muscle: origin, insertion, belly and tendon, aponeurosis and rough. So we'll see one by one. This is our muscle. Okay, this is a general diagram of a muscle. Now this part is origin. Okay, one part is origin and the another is insertion. Okay, from a particular bone a muscle originates and insert in the other. Okay, now the definition is given: origin, the end of the muscle which is relatively fixed during the contraction. Insertion, the end of the muscle which moves during the contraction. Okay, the two terms origin and insertion are sometimes interchangeable when the origin moves and the insertion is fixed. Okay, it can be interchanged in some situation. Now what's the belly? The fleshy and contractile part of the muscle. This is the fleshy and contractile part. It is the belly. Now tendons. Tendons are found over here. The small tendons, the fibrous, non-contractile and cord-like part of the muscle. It is tendon. Aponeurosis, the flattened tendons. Okay. Raphe, a fibrous band made up of interdigiting fibers of tendons or aponeurosis. Unlike a ligament, it is stretchable. Ligaments are fibrous, elastic, inelastic band which connect two segments of a joint. Okay. Terms used for describing vessels. Now there are 4 types of vessels in our body: arteries, veins, capillaries and anastomosis. Okay. First, arteries, vessels that carry blood away from the heart to rest of the body, from the heart to the rest of the body. Okay, is arteries. They carry oxygenated blood. Okay, exception pulmonary and umbilical arteries which carry deoxygenated blood. There are few exceptions, that is pulmonary and umbilical arteries which carry deoxygenated blood. Okay, arteries resemble trees because they have branches. Okay, we can see in the diagram further. Now veins, vessels that carry blood towards the heart from other parts of the body. Okay, they carry deoxygenated blood. Okay, exception में क्या रहेगा? Pulmonary and umbilical vein which carries oxygenated blood. This is opposite in both the situation. Veins resemble river because they have tributaries. Veins have valves to allow unidirectional flow of the blood. Unidirectional means एक जगह. Now what is capillaries? Are networks of microscopic vessels connecting arterioles to venules. Okay. Anastomosis is a precapillary or postcapillary communication between the neighboring vessels. Okay. Terms used for describing bone features: elevations, ramus, depressions, opening, cavity, smooth, rough, many more there are, which we use to explain any bone. So these are all the general part we are studying about. What are elevations? Like linear elevation may be like a line, lip, ridge, crest. Okay, we'll see one by one in the bones topic. Sharp elevation may be a spine, styloid process, cornea. Rounded or irregular elevation may be tubercle, tuberosity, epicondyle, malleolus, and trochanter. Okay, these are few terms we use for bones, for explaining the parts of the bones. Ramus. It is a broad arm or process projecting from the main part of the body of the bone. Okay. Depression may be a pit, impression, fovea, fossa, groove, or notch. The holes or the grooves is collectively known as depressions, but in different bones we use different terms. Somewhere we use fovea, somewhere we use pit, somewhere we use notch, somewhere we use sulcus, groove. Such terms are used. Okay. Opening may be a forearm, canal, hiatus, or aqueduct. Okay. Now cavities. A large cavity with a bone is called sinus. Okay. Cell or antrum. Now smooth. Areas may be a facet, condyle, head, capitulum, trochlea. The things which are smooth. Now there are things which are rough. It will come. Somewhere there are smooth surfaces where the bones articulate. Somewhere there are rough surfaces where the bones articulate. Depends. Now, arrangement of the structures in the body. The structures are mentioned from within outward. Bones from the supporting framework of the body, and muscles are attached to the bones. It's a general thing, like blood vessels, nerves, and lymphatic form neurovascular bundles which courses in the between the muscles along the facial planes. The thoracic and abdominal cavity contains several internal organs called viscera. Coverings. The whole body has three general covering: superficial to deep, that is skin, superficial fascia, and deep fascia. In general, there are more layers and coverings we'll talk about, but in general there are three. Now, chapter 1.2, parts of the human body. Now, external part are the features you can see, feel, body surface. These are significant for physical assessments and anatomical studies. Understanding these is essential for locating acupuncture points. Okay. Head contains sensory organs like eyes, nose, we all know that, divided into the skull and the face. Critical for communication and perceptions. Okay. Now face includes the forehead, cheeks, jaw, chin, temples, which play roles in expression and communication. Okay. Neck, a cylindrical structure connecting the head to the torso. Okay. It contains important landmarks like cervical vertebrae, carotid arteries, and jugular veins. Trunk, torso, chest includes ribs, sternum, diaphragm. These are all theoretical part. Abdomen, the region between the chest and pelvis. Okay, this is the chest. Okay, this is the abdomen. Okay, this is pelvis. These are upper limb. These are lower limb. Okay. You can see better in this diagram. So these are all theoretical part. Now internal organ, we'll see the brain, heart situated here. Okay. Then stomach, pancreas, bladder, male reproductive, female reproductive, intestine, kidney, gallbladder, liver, lungs. We'll study these in detail. Now anatomical plane we have done, so we'll just skip this point. Now what are tissues in broad outline? This we'll see in the next